Hi guys, I'm Dr. Jagdish Chaturvedi. I'm an ENT surgeon. I was born in Bangalore, raised in traffic. And in my standstill life, I was thinking what to do. I thought, why not host this panel? And we have a very interesting panel over here for the most important subjects in your final year. And I'm going to be talking to them some really, really important things for you that you can use in your upcoming preparation. So what we'll do is I'll go from this side, and I would like to ask Dr. Sarath if you could talk a bit about yourself. Dr. Sarath, by the way, is also a movie buff, likes to watch a lot of films. But on the other time, what do you do, Dr. Sarath? If you can talk a bit about that. And what are the trending topics that you see in pediatrics and the trend of the questions that are coming in these exams? That will be great.
I'm Dr. Sharath Balaji, a practicing pediatrician as well as a teacher for the past 12 years. I have been teaching NEET PG aspirants since 2010, and I have been working as an associate professor in the Institute of Child Health, Chennai, Madras Medical College, which caters around 950 bedded exclusive pediatric hospital, and which is the largest one in Asia. And as far as pediatrics is concerned, we can say core pediatrics. Core pediatrics includes your growth and development, your neonatology, your immunization, your nutrition. This is core pediatrics, and among 20 questions that they have been asking in pediatrics, 15 questions will be asked from these core topics. And with respect to specialized topics which are exclusive to pediatrics, they are: one, integrated management of neonatal and childhood illness; second one is inborn errors of immunity; third one is inborn errors of metabolism. These are topics which are so exclusive to pediatrics. And when you come to systemic pediatrics, when you read about general pediatrics, such as systemic pediatrics with respect to pulmonology, nephrology, neurology, and so many things, you can be a little bit choosy while reading those topics, because the concept will be the same, the physiology, pathology, everything will be the same. But with respect to the disease spectrum, it is so quite different when you compare with respect to medicine. So when you come to pulmonology, you need to concentrate on respiratory noises, cystic fibrosis, celiac disease, and primary ciliary dyskinesia. When you come to gastroenterology, you need to concentrate on acute diarrheal disease management and chronic diarrhea, cow milk protein intolerance, etc. When you come to neurology, you need to concentrate on epilepsy as well as some cranial malformations. So when you cover these core topics, as we discussed already, that is your neonatology, growth and development, nutrition, as well as immunization, you can answer up to 10 to 15 questions. So the rest you can manage with the help of your basic knowledge in medicines. But you need to be so sure in topics such as IMNCA, as well as inborn errors of immunity and inborn errors of metabolism, that we are going to deal in our course in detail as well as in a crisp manner.
Great, wonderful. So just to summarize, though pediatrics is a subject that deals with small children, the questions here are not small, and they are big and most important for you as well for your exam. Moving on to Dr. Shonali over here from OBGYN. She also is a singer and a guitarist in her free time. So Dr. Shonali, a quick introduction, and what are the trends in OBGYN at the moment?
All right, so I'm Dr. Shonali Chandra, and I did my post-graduation and senior residency from Maulana Azad Medical College, New Delhi. And then I practiced OBGY in clinical practice also as well. And currently I'm working with Jan Swasth Sahyog. I'm associated in community health and nursing health and everything. So that is my line of work. And I've been involved in teaching now for the past 8 years, teaching postgraduate aspirants. So that is what I've been doing. And as you asked, what is the trend that is going on as far as OBGY is concerned? So what we've been seeing over the past 4-5 years is that, yes, they're asking more and more clinical oriented questions from OBGYN, right? So anything, let's say, for example, let's talk about a woman in labor, let's say, right? So you need to know what would be the antenatal care of that woman, right? And then again, once you start talking about antenatal care, you start talking about what is the general care that you will give, what will be the general sort of complaints, and then you have to identify the high risk women, right? So there it begins. You start adding to your topics, important topics list, right? Like for example, you read about preeclampsia, very common, and very common in our country in tertiary care hospitals. So you need to identify these women with high risk pregnancy factors, right? Then the same woman will go into the labor room. Then you need to know the obstetrics of normal labor, how to identify a woman in labor, then how to identify the risk factors that will come there, the complications that will come there, and how you will go about it. Because as an undergraduate student, you are expected to be able to take care of at least a normally laboring woman and identify the complications that can arise out of the process. So that covers the obstetrics part most of all, right? And if you look at the trends in gynecology, yes, they've been asking questions on reproductive health. And when I say reproductive health, this is a very broad term, so they can ask you questions regarding, let's say, for example, a woman comes with the complaint of abnormal bleeding. So that is a symptom, that is her complaint. And then from there on, you can go on to what could be the possible reasons for abnormal bleeding. And all those differential diagnoses by themselves become important topics. Infertility, a very, very important topic, considering nowadays that infertility is a major issue here. Then amenorrheas is an important topic. So we are seeing trends that is going towards asking more and more clinical oriented questions. And another important aspect in gynecology is gynecological cancers. And just came on top of my head that this is the Cervical Cancer Awareness Month, January. And cervical cancer is a major cancer in our country, most common gynecological cancer in Indian women. So they ask you a lot of questions about that as well.
Well, wonderful, wonderful. And I think with OBGYN, I somehow feel that, for most problems in OBGYN, there is a man involved, like because in amenorrhea, there is men. In gynecology, there is guy. In hysterectomy, there is his. So I'm just wondering whether there is a message over there. But anyway, jokes apart, I had a very interesting first internship when I was in a district hospital in Tumkur, and it was first of May, literally Labor Day for me. But now moving on to Dr. Santosh over here. So Dr. Santosh is a fitness enthusiast, also does a lot of gymming and now into a lot of health and fitness. Dr. Santosh, after your introduction, what are the trending questions being asked in medicine nowadays?
I'm Dr. Santosh. I am a partially trained anesthetist and a fully trained physician. And currently, I am into teaching for NEET PG from almost 10 years. I'm also teaching for NEET SS, and I've authored some books for NEET SS students. Coming to the trending topics in medicine, medicine was always trending, and almost every system and every topic in medicine is trending. Starting from genetics to the core medicine, cardiology, neuro, everything is trending. But the change that I've seen in the recent times is the questions are becoming more clinically oriented. And the only way you can dissect these questions is when you understand how to deal with the differential diagnosis. The question story is all about dissecting the differential diagnosis. So the very opening statement introduces you 4 or 5 differential diagnoses. The subsequent statements that appear in the question are helping you to dissect those differentials. And at least you should be left with 2 differentials when you've completed reading the question, so that you can pick up the right answer from that. In respect of listing the topics, it's going to be very difficult because we're now talking about the concept of next coming up. And once the next comes up, it's going to be 120 marks paper for medicine. So when it is 120 marks, almost every system will get good representation. So you cannot ignore anything. You have to also concentrate on geriatrics, you have to concentrate on genetics. So no system can be ignored. You don't need to be master of any of the systems, but at least the basics of all the systems you need to know.
And one thing I like about differential diagnosis is for most conditions which I don't know the answers for, I just say it's idiopathic. But I like that, the terminology, especially if there is a fever and you don't know what's the cause, you call it fever of unknown origin. But it's nice, PO. But moving on to Dr. Sandeep over here, he's a surgeon and apart from cutting on patients, he's also a cricketer. He does a lot of off cutters and leg cutters. So Dr. Sandeep, a bit of introduction about yourself and what is the trending questions that's coming in surgery?
Hi guys, I'm Dr. Sandeep. I'm a general surgeon and onco surgeon trained in fellowship. I've been teaching for last 8 to 9 years. It's been a while now. Coming to the trending questions part, surgery per se, it looks vast, but unlike medicine, there's not much to read, but lot to understand. It's more of pictorial representations. You need to understand how things are done, how they play out. Yes, everything is becoming clinical, but I feel the trend in surgery is becoming much more easier when compared to the one-liners, right? As the image becomes more clear for us to understand, the answering part also becomes easy. Systems wise, general surgery is becoming lot more important, right? The core general surgery, you're talking about drains, you're talking about incisions, you're talking about approaches rather than systemic part. Systemic part has taken a little bit backseat. Urology was considered to be a very important topic. In recent trends, it's onto a slightly lower part. Malignancies are becoming very important, especially in terms of management stage wise, right? Earlier they used to ask only a particular management, now it is stage wise orientation. We need to focus down there. Apart from that, breast has always been the most important topic in surgery. Head and neck is an important part, especially the thyroid orientation, right? So all these are the trending parts. Rest assured, I don't think surgery will be difficult. We'll make it much more easier for you as well.
Yeah, and I remember, steps, surgical steps are particularly important, right, in surgery. During my internship, I was once asked, what are the steps of appendectomy? And I said, you make an incision, take out the appendix and close it. And I was immediately cut out from the department. But you have to have more detailed steps, and I think there are a lot of sequences and anatomical relations that are important. Now, we have some questions from some very curious students, and I would like to share them over here. Let's start with Dr. Sharath over here. We have Charmi Parik, who's asked a very charming question. She's from Pramukh Swami Medical College, and she's saying, can you share an easy technique to learn developmental milestones? And I also want to know the answer to that.
The most difficult question we can have. So basically, with respect to any subject indeed, as Santosh told, we need to have a concept behind each and every fact. So people used to start with etiology, then so many causes, then pathogenesis, then symptom, sign, differential diagnosis, treatment. But when they come to that symptom analysis and signs, usually they will be tired and their mind will be full of facts. But instead of reading in such a way that we need to apply the concept of retrospective reading. So what do you mean by retrospective reading? So you need to apply the formula of SOAP. What is that SOAP called? Subjective, objective, analysis and plan. So what do you mean by subjective? Whenever any child comes with the cough and fever, it can be a case of pneumonia, it can be a case of simple viral infection, it can be a first manifestation of a primary immunodeficiency, it can be a manifestation of cystic fibrosis, so many things. So symptom analysis comes first. Whenever any child comes with any particular symptoms, as Santosh told, what are all the top 3 differential diagnoses we need to have in our mind? So what does it mean that common things are always common wherever you go in any part of the world? Point number 1. Then with all those differential diagnoses in our mind, we need to go for the signs. So for that particular differential diagnosis with respect to the history, how can we crack those differential diagnoses? By looking at certain specific signs. For example, if it is a case of pneumonia, you need to have a tachypnea, you need to have a chest in drawing, or you need to have an associated danger signs. If it is a case of cystic fibrosis and associated protein energy malnutrition, associated symptoms and signs of fat soluble vitamin deficiencies such as a bite or spot, all those things can be visualized or not. So with this symptom analysis and application of signs, that is symptom what the mother is going to say, sign what the doctor is going to visualize, and then with this symptom and sign, then we need to come to plan. So what is the next investigation of choice I need to take? Whether I need to go for a complete blood count to know whether it is a bacterial or viral infection, whether I need to go for a chest x-ray, whether I need to go for a stool for fat cells or sweat chloride, or it is a simple viral respiratory infection in which I need not go for any further investigation, just an observation would do. And then finally plan. So what is the thing I need to apply? Whether I need to do an investigation, I need to wait, or I need to give some medicines. And finally, what are all the expected complications? So each and every student, when they read some subject, we need to think in such a way that when such a kind of complaint comes to their clinic, so what are all the patterns that which they are going to apply? That is how you need to read. Instead of simply reminding all those facts, 1, 2, 3, 4, 5 points, you need to apply the concepts. So that is what our physics wala is going to aim with. We are going to deal with concept based teaching. Whenever you apply this concept based teaching, definitely it will stay in your mind for a long time. That is what we are aiming for. It should be crisp as well as it should be concept based, along with embedded MCQ pattern questions, along with clinical based questions. And when you come to this question in particular, the best way to remember is to have a kit. Okay. So when you have a kit, it is easy to crack at what are all the milestones which are achieved at what specific ages. But at 24 or 23 years of age, when you are about to crack your PG entrance examination, it will be difficult, or else you need to have kits from your brothers and sisters. Okay, so when you don't have your own kits, or when you don't have your brothers or sister kits, then watch our video on our physics wala sprint pattern. In the next month we are going to release. That is what we want to say for now. Thank you.
Wonderful. Thank you, Dr. Sharath. And my parents are still complaining I have not met all my developmental milestones. They keep asking me to grow up. But now coming here to Dr. Shonali, we have Neeti Sharma from Kalpana Chawla Government Medical College, who's I think asking a very common question that you must have heard, is how to correlate clinics and theory during practicals.
All right. So I believe what she's wanting to ask is that when you have your practical examinations, you have your clinical case presentations and your final year MBBS examinations, how to crack those. And part of it actually has been answered by Sir already, the differential diagnosis approach. I'll kind of give an example to what he's already said in the obstetrics and the gynae part of it, right? So let's say, for example, a very common complaint. Let's say you get a long case in your examination. Your gynae case is a woman has come with the complaint of heavy bleeding during her periods, right? How do you go about it? There are n number of questions you will ask her in a menstrual history, as to are they regular or irregular? How much is she bleeding? When she starts bleeding, you also have to note that, she could have had a pregnancy-related complication. Maybe she's aware of it. Maybe she's not aware of it. So when you have to start thinking about the clinical approach, you have to start thinking about the person as a whole, as a patient. In a reproductive age group woman, there can be pregnancy-associated complications which could be responsible, or gynecological conditions which could be responsible. And like I said, that you have a certain number of differential diagnoses with you. Like, for example, there could be something wrong structurally with the uterus, like, there could be fibroids or polyps or adenomyosis, right? Or maybe hormonal disturbances. And you go along to differentiating lines of differential diagnosis altogether. So the fact I'm trying to make here is that, you have all these different pieces of information somewhere there. Because you've read about it. You've read about fibroids separately. You've read about adenomyosis separately. You've read about gynae cancers leading to abnormal bleeding separately. Now you have to think about everything together, right? So when you take that history from a patient, it has to be directed. You have to know what to ask. Otherwise, it doesn't work. Otherwise, you'll be lost at whatever the patient is telling. You have to ask because you're ruling out the differential diagnosis. So you need to know how to differentiate between them based on history. Some things will be common to them. Some things will be the differentiating factors. Then you go about the examination. Once you're done with the history taking an examination point of it, then you'll think about what investigation is best for this particular patient. And this is where, once you're giving the viva in clinical examinations, we say, treatment you are going to reach once you complete the history taking examination part, right? So once that is done and you're being asked investigations, in your books, you read there are n number of investigations. There are high-end investigations. There are simple investigations, right? So you have to see, based according to the history and examination findings, what are you expecting your most top two differentials, let's say, and then how to differentiate between the two. You will order an investigation. So you have to develop that perspective, and it comes with a little bit of more practice than what we are used to doing, because it's not simply mugging up and reading from textbooks, one topic complete, second topic complete. No, if you have to integrate, you will have to think about it, a symptom-wise approach. and then rule out differential diagnosis. And yes, we are here to make the effort with you people as well. Like sir said that we are going to launch the sprint in the coming month, which is going to be a rapid revision series for the upcoming NEET PG examination. And the best way to deal with such scenario based questions is to practice as many scenarios as possible.
Wonderful. So just like a good gynecologist, your answer should have a good delivery. So moving to Dr. Santosh over here. So Dr. Santosh, is an interesting question over here by Riddhi Challa from AG Institute of Medical Sciences. What is the best way to manage time in long questions?
Now that the next is going to come, and already we have seen the glimpse of what next holds to us in the recently concluded NEET PG exams, we have started seeing long, lengthy questions where literally a story of patient is there. What I generally recommend is that you should start from the bottom of the question. You will get to know the examiner's mind, what he wants to know from the question. So the question may be asking about what is the most common cause for this kind of presentation. So when you read the bottom of the question, the last line, and then start from the first line, you already know what is expected from you from the story. So your mind can quickly navigate through the information and take you to the right point that you need to know, or right chord that you need to catch. That will save a lot of time. So that is what I practiced during my USMLE days, and it did help me to crack USMLE with a good score. So that's one tip. Second tip is when you're starting from the beginning, when you start studying medicine, your first exposure happens in your second year of medicine, second year of your UG program. So that is where you start applying everything from the differential perspective. Start thinking like physician from second year itself. So when you're talking to a patient, like for example, his first complaint is, I've got cough. In your mind, you should have some 10 differential diagnoses coming up for cough. The next information that is given to you from the patient is that the cough is nocturnal. Now your differential diagnosis should get narrowed down. The third information patient might give that he has a family history. Your differential diagnosis further gets narrowed down. When you keep thinking this way, you can handle these lengthy, long questions much simplistically, because when I'm practicing, when a patient walks into my OPD and starts telling his story, within 2 or 3 minutes, I would have had a zero down to at least 1 or 2 differential diagnoses. So if you start thinking like this, even when you start reading a question, 2 or 3 lines itself will give you the narrowed down diagnosis. That is one thing. And second thing is, keep out the fear of long questions, because long questions means more information. One-liners, you know you can answer. You don't know, you'll not be able to answer. But long questions, some of the clues you may not be able to catch up, but there's still some clues which will lead you to the answer. So first, eliminate the fear of long questions. To manage time, read the last sentence and then start with the first part of the question, and hopefully you will be able to do well.
If you want to get to the bottom of the matter, start from the bottom. And I think if I knew that, I would not be in the bottom. Great. Very good insights, actually. Very practical. So now on to Dr. Sandeep. So Dr. Sandeep, there's a question here for you by Rajendra Singh Jadeja from Narendra Modi Medical College. What is the best technique to score well in surgery in NEET PG? What's the secret technique?
Particularly in talking about surgery exam pattern, it narrows down to very basic things, 2 important things. Do your 5-year question bank, NEET, that's a repeat question, that's a must. I say 10 sessions of your INICET, these are the clut. Now, if you analyze your exam from last 10 years of the set that we have, 70% of the topics are repeat topics. I don't say the questions are exactly repeated, but the topics do repeat on a very frequent basis. So if you understand, let's say you've done 5 years of question bank, you don't need to mug up those questions, but if you know those topics and revise them well, 70% of your questions are there itself. Not only in terms of surgery, any subject per se that matter. Specifically talking about surgery in terms of scoring, there are areas where you will get a question. For example, when you're talking about pre-operative management, there will be one question for sure. Intraoperative management, there will be one question for sure. Post-operative complications, obviously a question. Breast, there will be a question. Thyroid, there will be a question. In the entire GIT, we are expected to have stomach one, particularly in terms of cancers. Now the trend has moved towards esophagus. Earlier we used to ask about colorectal cancers. Now upper GI cancers are in more trend. So these are the topics that you have to focus on. And once you start analyzing, now if you say, as I told in my earlier part also, urology has lost its importance in terms of exam. But now if you go into Euro, now the Euro trauma is becoming more important. In terms of now the protocol-based questions are more important. So these are the stuff that you have to look across here, revise 5 years question bank, get to those topics, and I don't think it should become any difficult from there.
Moving on to some more extra questions that are there over here. There's one here for Dr. Sharad. So there's a question over here which I think a lot of students have in mind is there's an overlap between pediatrics and medicine. How does one deal with that in your preparation because of the overlap? Does it cause confusions? Or what is your say on that?
As it was told already in our previous discussion, core pediatrics is different. Whether if it is NEET, 15 questions will be asked from, as we discussed already, nutrition, growth and development, milestone, immunization, IMNCI, newborn. So complete it thoroughly. You are not supposed to compromise in it. One. When you come to systemic pediatric per se, you can choose the topics. Because as we discussed, the concepts will be the same with respect to pediatrics, pathology as well as your medicine. The concept will be the same. But you need to choose the topic. So when you come to cardiology, instead of concentrating on acquired heart disease, in which our medicine faculty is going to complete it. So we will be concentrating more on congenital heart disease. Whether the diseases will be associated with pulmonary oligemia or pulmonary plethora, we are going to concentrate more on congenital heart disease. And what are all the recent changes with respect to the criteria of rheumatic heart disease? Is there any recent change, whether it is high prevalence, low prevalence, etc.? In the same way, each and every topic have got specific pediatric specific questions that we are going to deal with. Okay, so concentrate more on core pediatrics. So if you have time, you can concentrate on systemic pediatrics. If you don't have any time, try to finish your core pediatrics first. That will give you almost 70% of pediatrics questions. And beyond that, one more advice that our team wants to give is, yes, you can read from so many apps, you can read from so many faculties, but who is your best teacher? The best teacher will be your patient. Please do not scoot your internship. Okay, by staying with the patient, by staying with the bedside, you can learn more. So whenever you have a case of COPD or whenever you have a case of asthma, so ask all those questions. Which one is predisposing for all these life-threatening attack, whether the patient is on inhaler therapy or not. So ask all those questions. You come and read all those patient-related topics in our app. That is the best way of applying your bedside knowledge as well as theory knowledge. Never ever compromise your ward duty for getting an entrance examination. That might be the best advice from our team.
So great, stay clinical, have as much exposure as possible, otherwise it's not going to be a child's play for you. All right, so now we have another question here for Dr. Shonali, and the student is asking, what are the important topics for NEET and university exams when it comes to OBGYN?
Okay, so when we talk about the list of important topics, I feel somehow my questions are half answered by Dr. Sharath on this side. Like, he spoke about the importance of being in the clinics, being in the wards, right? And that is my list of important topics for you people. Whatever you are seeing in the OPD, whichever ward patient you have admitted in your gynae wards, in your gynae oncology wards, or in your obstetric wards, in your labor rooms, whatever you are seeing day in and day out in your posting is the most important topic. That's all. So like, you have your gynae OPD, you have women coming with a very minor complaint of discharge per vaginum. And there you are. All your important topics, the genital infections, your pelvic inflammatory disease, genital tuberculosis, right? You have women coming with abnormal bleeding. All your reproductive age disorders are very important. Women coming with infertility. Your entire list of anovulatory disturbances in the woman is an important topic for you people in your examinations, right? Basic infertility workup. We're not asking you about very high-end IVF techniques. You know, don't need to read too much into that. I've seen students read too much into that also, but basic infertility workup is what is very important. Now, they have also started asking about male infertility a lot in the gynae part of the questions. And if you look at the list of important topics from obstetrics, like I said, Again, care of a laboring woman. When I say broadly, I mean your labor management, active management of labor, third stage of labor. These are very, very, very basic care of laboring women. These are questions which can be made difficult if you don't know the concepts behind these very simple techniques that we follow in the labor room, right? So you have to be thorough with that. I mean, if you're not able to answer those sort of questions, then you may know whatever else there is to know, but if you can't answer about basic obstetric care, then there is no point, right? And similarly, again, the important topic is puerperium. Very, very important topic. Recently, over the past couple of years, they've been started asking you about, more about obstetric hemorrhages. Very, very important. Bleeding pregnant patient, bleeding immediately after delivery, postpartum collapse. These obstetric emergencies, they are again becoming important topics, because these are a set of things, these are the set of topics you'll have to read through and through. Right? I mean, you'll have to read them from textbooks, you will have to know more about them, you will have to see patients for them. So these are those important topics. Other than that, again, yes, there are a set of topics which are like, medical disorders in pregnancy. These are sort of, or maybe surgical disorders in pregnancy. These are topics I feel that you may not read cover to cover, right? But you can go and do questions from these topics and, read them in a retrospective manner. So I think when you do all this much, it covers about 70-80% of your course.
Wonderful. And I think to summarize, I think wards are the place where you get all your important questions. And I think that's a very important set of words that you have said for us. So now moving to Dr. Santosh. So this question is, how to be a good clinician and become less dependent on investigations? This is a question asked by Praveen Kumar from Veda Institute of Medical Sciences.
That's an interesting question, because nowadays practice is driven by investigations and we are putting less effort in making clinical diagnosis. But I think we should create clinicians for the future, not investigators. And that's a very valid question. And I think the importance has been already emphasized by Dr. Sarath Balaji as well as Dr. Shonali Chandra. There's a saying in medicine which says, listen to your patient, he's telling you the diagnosis. So you don't need to run behind investigations. If you're listening to your patient carefully, you're taking a good history, mostly diagnosis unfolds itself. You don't need to unwrap it. And like one of my teachers used to say, at the end of your history taking, if the patient doesn't end up telling you, sharing with you his bank account details and his illegitimate affairs details, then your history is not complete. Basically, that means that you should make the patient comfortable and get a good history. If the history is good, your investigations will be minimalized, because at the end of history, you have very narrowed down differential diagnosis. Mostly you're investigating for confirmation or dissect one or two differential diagnoses. If at the end of your history, you have 10 differential diagnoses, then you need 20 investigations. So history is the most important thing, and that is missing from current crop of medical students. And I do welcome this recent change in MCQ pattern where the questions are becoming clinical. Most of the questions have a standard template. So first 2 through 3 lines are about history, then 1 or 2 physical examination findings, and 1 or 2 investigations. So it puts the emphasis back on history. Even for your entrance exam preparation, history is important, and that cannot be just easily learned by reading textbooks. So you have to spend time with patients in wards. So don't compromise on that. That itself, like if you do that, you are bound to become a good physician, good clinician, and you are not going to be dependent on investigations.
I think history is very important, and that's why most of my searches are on the internet are in incognito mode. Moving on to Dr. Sandeep over here. So Dr. Sandeep, so many surgeries and, everything is, got a lot of steps and it gets very complex and confusing. Is there any trick or tip that you would suggest to students to remember it? That's a question that's been asked.
See, surgery per se, in terms of steps, they're very basic. Everything is simple. You understand your anatomy, you will be able to get through it. For an undergraduate, the basic surgeries that you should know, for example, most important steps of appendicectomy, steps of herniatomies, thyroid surgeries, breast surgeries, these are the important ones. Now, when you come down to steps, what is there? From the skin to the organ, that's it, right? So you know your skin, you know what comes next, subcutaneous fat, you know what the muscle is there, or an aponeurosis, you get through that, you get into peritoneum, you're in abdomen. That's the steps. Nobody's going to ask beyond that. Same in thyroid, right? You go to the skin, you get to your next subcutaneous fat, you have a muscle, platysma. Same in terms of, your anatomical orientation, you have strap muscles dissected, you are in thyroid, remove it, done. So the steps are uniform uniform for all surgeries. Yes, if the question is about how to remember the various names of the surgeries, you're talking about various techniques of the surgeries, yes, that becomes slightly difficult and tricky for an undergraduate to know all the different techniques. But there are certain important ones which we'll be discussing in detail, and I'll also tell you that, in what best way you can remember and recall them as well.
All right, guys. So I think we're almost towards the end of this discussion. I have two common questions for all the panelists over here. Is there's so much of information that the students gather, and medicine is vast. How do you revise? What is your revision strategy or revision technique that you would advocate for students? Let's start here from Dr. Sharad.
Whatever it may be, whether it is a surgery, medicine, gynec or pediatrics, when you come to some fancy topics or commonly asked topics, it will come around only 30 to 40 topics in per se. So they will be asking so many permutation and combinations of those questions from those selected topics rather than asking some remote topics. So if you don't know one answer and if you are not so sure with one particular question, please make sure that, or please you need to confirm that, or you need to know that majority of your colleagues are also not aware of that particular topic. So when you make a mistake in these common topics, you will lose rank. So that's why what we want to advise is you need to be thorough with some 40 to 50 common topics that are often asked in the previous entrance papers. So you need to be very, very, very solid core knowledge in those topics. When you don't do any mistakes in those topics, definitely your rank is finalized. Please do not worry about all those difficult questions, remote questions, everything. Because if you don't know, majority of your friends are also don't know. So please do not get confused with all those difficult topics. Please read carefully each and every point of commonly asked topics. That is more than enough to cover in the coming month. That's it.
So wonderful. I think on that same point, maybe you can also add.
I was just about to do, add on to what it already said.
And also perspective of sprint that's coming out now with the sprint with Physics Wala. So with the revision, what can students expect also in the sprint sessions that you'll be taking?
To add to what sir already said, yes, we would be taking up previous year questions, right? So they give you an idea about the important topics, first of all. Secondly, they also give you the idea about the pattern of questions that are being asked from a particular topic. So when a topic has been asked once, especially recent, previous 5-6 years, then the things around that topic also become important. And in sprint, we will also be focusing on how best to attempt MCQs. You see, at the end of the day, it sort of becomes an exam where you're being tested on your exam taking ability, at least a part of your exam taking ability. So sometimes, you get hassled by these long questions, maybe some topic which you have read but you're not very confident about. But then you have to, when your concepts are strong, when your foundations are stronger, many times you can eliminate options. And that also comes with practicing questions. How can you best eliminate options, right? And again, we're looking at more integrated questions being asked, so they can give a clinical scenario. Maybe they ask you a diagnosis straight away, or they may ask you the pathology of it. So what I'm trying to say here is, yes, that the foundation year subjects, to understand good surgery, you need to have a strong understanding of anatomy, right? When you want to, let's say, for example, study about endocrinological disorders and gynecology also, you need to have a strong understanding about, endocrinology in general also. So that is why concept building is important. Many times your questions can get answered by your basic knowledge also. Sometimes, you have options where you have no idea about a particular option, but you may completely rule it out because that's entirely untrue or maybe true, or whichever ways it works. So you have to work around that, eliminating options. So that would be a strategy for sprint. Do as many questions as possible, revise a wide variety of clinical topics, discuss a wide variety of scenarios. We could start with one question and then build on it, and to see how best to eliminate options. This works with discussion. It could be in the form of sprint, or 4 friends can sit together and discuss MCQs. That works as well.
Wonderful. Yeah, that's a nice way of putting it. So, Dr. Santosh, what can the students expect in the sprint that you're going to conduct?
So first point, in the sprint, we will be primarily focusing on PYQs. The simplest reason is medicine is a very vast subject, and some of you have started well, and you're prepared well. For you, it's adding that final touch. And some of you are not well prepared, but still you want to make the most out of medicine. So for both of you, my suggestion is to concentrate on PYQs, because you all know not just the questions, but the topics from which the questions are asked keep repeating, because the common things are common, right? So dengue is common, questions on dengue are going to be common. HIV is common, questions on HIV are going to be common. So concentrate on common things. As Dr. Sarath Balaji told, don't worry too much about the rare things. Yeah, some questions will be rare, but they will be difficult for most others. Yeah, and with respect to revision, another point I want to add is that you choose your right source, which you can complete, because revision is very, very important. If you can only read once, it is as good as not read. If you can't revise, it's as good as not read. So always choose a source which you can revisit multiple times. At least 3 or 4 times of revision is required. So if you have chosen a source which takes an entire year to complete and you will not be able to revise, you will have a lot more confusions in the examination hall rather than clarity. Clarity comes with revision. So those who have started well, completed your course, and are in the revision mode, I would say whatever is your resource, stick to it. Those who have not done well, now don't get stressed about it, just concentrate on PYQs. And in the sprint, I will be primarily focusing on PYQs.
Wonderful. And Dr. Sandeep, what would you like to add? What can the students expect in your sprint session?
Majority of the things have been discussed and told almost, right? One thing I would like to add is I tell all my students one very basic thing. You take a material in your hand and you ask yourself a question that, can I complete this material 3 to 4 times before my exam or not? As simple as that. If the answer is yes, you stick to that material for the entire your preparation part. If the answer is no, dump it down. Look for a material there you can read and revise, as Sir was telling the same thing. Second, there's a new fear that has been circulating in the aspirants, which is called as FOMO, fear of missing out, which all of us have already covered it. Do not worry about the things which are rare or which is going to be, there's always, when you guys are studying together, there's a friend, who will come and say, hey, have you read this question? Remember a golden word, that question is not going to come in the exam. That's it, right? So just stick to what you have, revise. See, if you have not done revision 3 times, it's no point, getting into the exam. As Sir told, if you're reading once, it's as good as not read. If you read twice, you've done something. If you read thrice, you're prepared. And how many times you revise from thereafter improves your rank, as simple as that, right? In the sprint, what we will bring out, yes, previous year questions, we'll try to concise all those bulky topics into, maximum 1 or 2 lines where you will be able to revise and relate. Do not try to add on. If you relate to it, keep it. If you don't understand it, just leave it. But we'll try to keep it palatable so that you will be able to remember, revise, and reproduce in your exam. That's the point.
Another point I would like to add, for the last 30-day strategy or just before, appearing for the examination, one should also not be piling up material in the end. Whatever you have already done, that's it. Just keep reading it again. Don't add new things to whatever you've already made. So your already made material could be, already created notes, or maybe notes that you yourself have created. Whatever works best for you, whatever makes you answer the question, stick to that strategy and don't add new material, at the last step.
So wonderful, guys. I think you've got a very good perspective from all these experts who are there in the panel and all the other faculties that are going to come in the next panel. So thank you very much, and all the very best for your preparations, and see you in the next panel discussion.